Hello there, thank you for taking time to watch the health channel. Today we are going to give you 7 tips on what to do when you have a newborn. Come on board. So tip number 1 is breastfeeding. All mothers are expected to breastfeed their babies, but we also appreciate the fact that some mothers, due to either medical condition or psychological factors or any social factors, one may not be able to breastfeed their baby. So if you're not able to breastfeed your baby, you'll talk to your pediatricians, and the pediatrician will assist you on what is the best food to give your baby other than the breast milk. But for those who are able to breastfeed their babies, usually they're expected to breastfeed their babies, and the number of times one is supposed to breastfeed their babies really depends on how hungry their babies are. So the quantities and the times, that is the frequency on how many times one is expected to breastfeed their baby, really depends on every baby, and each baby is different. But one, as a mom, you are expected to know hunger cues of your baby. Some of the hunger cues are: number 1, your baby sucking their lips; number 2, your baby putting fingers in your mouth; the other one is the baby turning either on the right side or on the left side as if they are looking for a breast; and the fourth one, which is usually the commonest, is your baby deciding to cry. Usually by the time your baby decides to cry because they're hungry, that means they're so frustrated, and most of the time they've already done all these other cues, but maybe for one reason or another you are not able to pick it. So we usually advise not to allow our babies to cry for food, that means for hunger. Whenever you see any of the hunger tips, please remember to breastfeed your baby. The second thing is burping. After every breastfeeding, one is supposed to burp. So either you breastfeed or you bottle feed using formula, you're expected to burp your baby. And usually the reason we burp a baby is because most of the time when the baby is feeding, they swallow air. And so if this air is allowed to go down without being burped when they're still very young, most of the babies will start having crying because of colic stomach pains. So one of the ways to avoid this, of course, colic pains is caused by a number of things, but gas in the stomach is one of them. So one of the ways to avoid this is by burping your baby. There are a number of techniques to burp your baby. The commonest one is where you put your baby on the shoulder, you hold the baby firmly, of course supporting the neck, because at this point in time they are not able to support their neck, and then you pat the baby on the back or rub the baby. Most of the time the baby will burp some after 5 minutes, some after 10 minutes, and some after 20 minutes. What you need to remember is you need to burp your baby after every feed, whether day or night. The other technique of burping your baby is where you put your baby to sit on the lap, supporting the neck and the back. You let the baby sit and let them lean forward. Most of the time they will burp after that. If you have any other technique that you have used and you think it's even more efficient, please remember to leave it on the comment section. The other thing that we need to also remember as you take care of your baby is to always to take care of the cord. Always clean your cord. You clean your cord after every diaper change. So what you're supposed to do is, or usually after discharge, if you've given birth to any hospital or health facility, they usually discharge you home with some either surgical spirit or chlorhexidine, either in a gel form or in a liquid form. We call it a solution. So whenever if you've been given any of those, you should remember to apply it on the stump and also at the base every time you change your baby's diaper. That way it will help the cord to dry and also to make the cord drop faster. Even more important, these are antiseptics, and so they will prevent the baby from getting infections, which are usually around the skin area or from the environment. So remember to take care of the cord, and even when the cord drops, usually by day 10 or 14 of life, after the cord drops, remember to always continue to clean the area that the cord was attached till when the skin has completely healed. With this, you're sure that your baby will not have any infection, because once the area is open, it's easy for infection to enter the system through that. The other thing that one is expected to do is to change their baby's diaper. Changing your baby's diaper is a mandatory. Most babies, whenever they have a wet diaper, they'll always cry. So remember to always change your baby's diaper after every feed. Usually what we recommend is when the baby wakes up, you feed the baby, breastfeed the baby. After the baby has breastfed, most of the time they will also pass home if they are usually between the first 2 weeks of life. So most of the time they'll breastfeed and pass home. That's very normal. So when the baby wakes up, breastfeed. After breastfeeding, change the baby's diaper after they've pooped. This has to be done every time the baby has pooped. There should not be any time where you know that your baby has gone to the toilet and you let the diaper stay there, because one is the baby is at risk of getting diaper rash, which sometimes may be caused by a prolonged wet diaper on baby's skin. So always remember to change your baby's diaper. A normal well-fed baby is supposed to have at least a minimum of 6 wet diapers, and this we don't count on poop, but we count on urine. So most of the time, at least 6 wet diapers in a span of 24 hours. As the baby grows, when they get week 2 to week 4, sometimes a baby may go for some days up to a week without passing poop. So as long as the baby is breastfeeding well, as long as the baby is still sleeping well, and the baby is passing gas, this is nothing to worry about. What you need to know is, remember that urine, there should not be any point in time where the baby goes for long hours without passing urine. If this happens, just know that is a concern, and maybe you need to see your pediatrician. Another tip that we should also remember is sun exposure. A baby is meant to be exposed to the sun. There are many benefits of sunbasking, and the commonest is the vitamin D, which is very important for bones development. And then the other thing is, especially for the newborn period, is the jaundice. Usually whenever your baby has jaundice, either it's the jaundice of the eyes, or you see it on the skin, or you see your baby passing yellow poop or yellow urine, the best way to remove the jaundice is through sun exposure. Another very good advantage of the sun basking is usually it increases the serotonin level. That means it helps someone sleep better. So apart from these benefits, the baby needs to be exposed under the sun, and what you need to do is you should time when the sun is not so strong. So usually between the period of 10 in the morning, before 10 in the morning, or after 4 in the evening, when the sun is not very harsh to the baby's body. The dressing of the baby. The baby dressing should not be too much or should not be too little. And how do you know that? Usually we say whatever the mom wears plus an extra layer. So if mom is comfortable with 1 layer, then the most the baby can wear is 2 layers. And if mom is comfortable with 3 layers, then the baby should wear 4 layers. Seventh tip that I see most parents struggling with is usually the amount of clothing while the baby is going to sleep. One should always remember that you should dress your baby warmly, but do not overdress. Still refer to what we just said, that an extra layer from whatever the mom is wearing. So what we need to know is do not overdress the baby when the baby is going to sleep. And when baby is going to sleep, remember they should be dressed warm. If it's a bit cold, then they should be dressed warmly, but do not overcover the baby. The rule is the beddings on the baby's cot should only cover the lower part of the body of the baby. So the bedding should never pass above the navel. So do not have beddings that cover the baby's face, or do not have beddings that go all up to the chest, because this risks choking. So, and the beddings of the baby should be very well tucked. And when you're putting your baby to sleep, the baby should be put to sleep on the back, not on any other side. And once the baby falls asleep, usually they'll turn their neck towards the right side or the left side based on their choice. So that's all I have for today. I believe this has been helpful to you, and thank you for taking time to watch this. Remember, if you have any questions or if you have any topic that you'd want us to discuss, please feel free to leave on the comment section. Thank you so much once again. Do not go, we have a bonus for you. Thank you. Why should you not worry about your baby? If you, for any reason, you touch your baby's fontanelle, it's okay. If you see your baby's fontanelle pulsating, it is okay. If your baby keeps on passing poop after every meal, it is okay. If you see your girl's genitals having blood, that means you've changed your baby's diaper and you see blood, it is okay, as long as there's no any other reason that you may think of for baby having blood in their genitals. It is okay. If you see your baby, either a girl or boy, is having a swollen breast, it is okay, because this is because of the estrogen levels in mom's blood. So that may take time. Do not attempt to express anything from the breast. What you need to do is just let the breast be, and once the hormones wear off, automatically the breast will shrink and disappear. If your baby keeps on hiccuping, it's also okay. If your baby keeps on sneezing, it's fine. If your baby is having a facial rash, as long as it does not have any white heads, it is okay. Or if your baby is just crying and you've done everything possible, it is okay. But if you think a crying is a bit too much, please go see a pediatrician. By too much crying, that means the baby is crying unconsolably. Worry. If you see your baby has reduced feeding, please see a pediatrician. If you think your baby is having fevers, and that means temperatures of more than 37.4, and the baby has not been vaccinated and you cannot explain anything, please see a doctor. And if you think your baby prefers to sleep more than normal, as in they refuse to feed but they just want to sleep, if that is not okay, please see a pediatrician. If you think your baby is crying unconsolably, as that's what we have just explained, please see a doctor. If your baby is starting to turn yellow after the 7th day of life, that is not normal, please see a doctor. And usually we call physiological jaundice comes after the first 24 hours of life. But if your baby was otherwise okay, and all of a sudden you're seeing your baby's eyes turning yellow, the urine is becoming dark yellow, please, that is something to be concerned about. Then you need to see a doctor. And if you see your baby has not passed poop or urine after 24 hours of life, maybe for any reason you delivered in a place and you are discharged within the first 24 hours of life, and your baby has not passed urine or poop, then after 24 hours of the same, please remember to see a doctor. Thank you so much, and I hope that is helpful. Remember to always tell us which topics you want us to talk about, and even more important, remember to give us your comments on what you think of this video. Thank you so much for subscribing at the Health channel. Keep it real. Thank you for watching your health.